Welcome to the Reinventing the White Coat podcast, where we delve into conversations aimed at helping you foster a healthy relationship with your career and yourself. If you're a physician feeling unfulfilled or burned out, or want to prevent yourself from going down that path, then this podcast is for you. I'm your host, Jennifer Scher, pediatrician, chief wellness officer, and executive and life coach. Sit back and relax as we explore ways to live your best life and have a career in medicine. Today, I welcome Dr. Fatema Meah, who is a fellow pediatrician. She started her career in academia, where she directed medical student clerkships, coordinated continuing medical education for the pediatric department at Flushing Hospital Medical Center, and was integrally involved in the residency program. She then transitioned to the humble world of outpatient practice, where I have the honor of serving as her partner. So Fatema, thank you so much for joining me today.
Well, thanks for having me.
This is so nice. I really wanted to bring you on. We've had such an amazing career together, and you in particular are unbelievably skilled and expert at really focusing on your people. And I think it's part of the reason why we as a group have been so successful. And I wanted to tap into some of your expertise. But I was hoping first you could tell us a little bit, other than how I introduced you, about your path, how you got here.
Okay, sure. I think that might be the answer to that question might be a little long, but I always love to start when I tell people about myself to say I'm a child of immigrants. I'm first generation. I am a Queens girl, born
Mhm.
and bred, and it has a lot to do with where I am today and why I am a general pediatrician and why I practice where I practice. So I grew up in a neighborhood with basically all immigrants. English was not the first language on my block,
Mhm.
and no one really had healthcare. I remember thinking as a young child that I would one day have a clinic. I would be a doctor and have a clinic on the end of the block so all the kids from the neighborhood would have a place to go. And that
Oh.
came from a few things: watching my mother gather kids from the block when we all needed shots to go to school. And she would take like 10 kids to a school clinic where we lined up and everyone got a shot. There was no consent form, there was no photo ID, but we all got shots. So, growing up that way made me want to be involved with uh, the underserved in a community that needed doctors. And I think that's why I ended up doing general pediatrics training in the Bronx, then going to Flushing Hospital, where I actually got to see kids that literally lived across the street from me. Um, One young girl that I saw, and I said, "Oh my God, you live across the street from me. I grew up right across the street." She goes, "And you're a doctor?" I said, "Yeah,
Wow.
and you can be too."
Aw.
Yeah. So, and then when I came out to work in Riverhead and Eastern Long Island, I ended up in a place with, again, a very immigrant community, which I love.
Yeah, which is pretty
That's
unusual on Long Island,
Yeah,
right?
well, not where we are, not out east. Yeah, and I think
Yeah.
I think that can be untrue. I think you'll find pockets of people from everywhere all over Long Island.
Mhm. Yeah. So, Fatima, first of all, it's really crazy to me to think about how things happen for a reason, right? I mean, we did residency together, and then, I mean, did you ever think you would leave that hospital setting? Like,
No, I really didn't. I think even as, a resident, I thought I would um, work in a residency program, do teaching, uh, and I really loved Flushing. I mean, I loved everything about it. I loved the community. I loved working in a place where, I shared a clinic with specialists. I loved the residents.
mhm,
I loved my boss, my chairman. She was great. She mentored me. I didn't think I'd leave.
mhm.
Yeah, it
So
was
why
hard.
yeah, so why did you? You left something that was good.
Yeah.
Um,
I think I just wanted to have a little bit more control of sort of how I would practice medicine and how patients would be treated. I would say that I really did not have my own patients when I was there because we supervised residents. I would say I had a small following of patients that would always try and come when I was in clinic. But I didn't really have sort of that longitudinal relationship with patients and families that part of me wanted.
Mhm.
And just to talk about regular life things, it was brutal. The LIE was brutal. I lived in Suffolk County and I was traveling to Flushing. And the idea of actually getting to work with you,
Mhm.
building something,
Right.
was very exciting.
And I love how we did it actually because it was baby steps, right?
Sure.
So we started, I think I mentioned this on one of my other episodes, but we started, I had something happened for me and I left my job, and my father-in-law was a pediatrician and said to me, "Well, why don't you just work for me once a week and keep your toes wet while you figure out what your next move is?" And as I started working for him, I started realizing that it was kind of cool and kind of fun, exactly what you said, to kind of be with those families. It was such a special community. And that's what I called you. I was like, "Who, Fatima, you got to try this out. Us, these academics, like, we don't know what it's like over here. Try it out." So you started coming once a week,
Right.
right? I mean,
Once a week, led to twice a week, led to 2.5 days a week, if that's believable,
uh
led to
in
3 days a week.
that Prius. Thank goodness for that
Yeah,
Prius on the LIE.
yes. So very slowly, we did it over many years.
Yeah.
And I'm grateful to my chairman who allowed me to do that, and
Mhm.
grateful to your father-in-law who allowed us to do that also.
We were really, really lucky. But at the same time, we sort of created something pretty cool. And largely, I want to talk about some of your kind of beliefs and understandings about how important it is to focus on your people as
Mhm.
the instrument to success. So tell me, give me some examples and some things that you've done over the years.
In terms of building people maybe at our office.
Yes.
Um, so I will. I actually pat myself on the back because I have probably brought on the most number of employees that we actually have in our
Mhm.
office, whether that's from people who ended up being receptionists or medical assistants or nurses, just by knowing them through the practice.
Mhm.
We have several of our employees that came to us either right out of high school or maybe even while they were in high school. And that's something I'm very proud of, to try and, identify young women. They happen to be young women who are looking to improve their lives, improve their family, learn, um, striving to, have a career and make something of themselves, and offer them an opportunity and a place where they can come and learn, to whether it's to be a receptionist and to, like we talked about recently, formulating emails, trying to bring yourself up and lift yourself up, and moving from a receptionist to a maybe a assistant office manager, even to an office manager, to have our medical assistants go to nursing school to become LPNs, to then go on to become RNs. And we now have one who's going to become a nurse practitioner. I take no credit for any of them, but I love watching their journey and supporting that.
Yeah, I've known you for so many years, and I never knew that it came from your days at Queens. That what you just said a minute ago about how you inspired that you came from the neighborhood, right? I mean,
Yes.
it's just
Yeah.
sort of who you are. You
Yes.
always find, um, the potential in people. And then what I find is that then leads to people in our practice want to give you so much because you give them so much.
I hope so. I hope that's the case. I think that's very important. I think we should all be doing that, right? What else is there if you're going to be a boss or be someone who's in leadership or in charge of something, it should be part of what you're doing should be to be encouraging growth in everybody that you work with.
Right. But what would you say to us, our colleagues, who constantly it's just so much easier to do it yourself than to teach somebody how to do it right now, specifically, right? So we were just having a partner meeting and we were talking about the workflows around maximizing the way to use the EMR and like the check-in process and training the staff to do certain things that we could do ourselves. Um, you know,
I mean, I think it's silly to think that it's easier to do yourself because it's once you train people to do things, it leaves you time to do other things. So, if it's easier for us to enter orders or enter imaging studies or enter this, that, and the other thing, with all of that time that I'm doing that, I'll see another patient in the day or spend an extended time with a particular patient who needs it. I think that we should be doing um, the most we can with our time. And I'm not sure if I'm answering your
you
question.
are exactly. The
Exactly.
problem is the
Yeah,
problem that I have, because you're so much better at this than I am, is you still need the investment of time up front to
of
get that
course.
right. And
Right.
so when you're in the midst of it, it's so hard sometimes.
I'll say it's the same as raising children, right? It might be easier to just pack their lunch or easier to just make their bed, but they need to learn to pack their lunch and they need to learn to make their bed. And once they learn to do those things, you're not doing them anymore.
Yeah.
So it's similar to parenting in a sense. And I think, maybe being a manager in an office there's a lot of that.
That is such a great way of putting it, Fatima. And you know what? My parenting, probably I did too much making lunches. Although I'll never forget the time when my son was like, I don't know how old he was. And I was so sick and tired of doing his laundry. I said, that's it. I'm not doing
Yep.
your laundry. Figure it out. I think it probably took 2 weeks of laundry building up. Like he was until he was like done with his underwear before he finally dragged it all and learned. And then I never did laundry again. So, but
Right.
it was hard to sit through that.
Yes. Yeah. Well, working 2 jobs, I didn't have time. They needed to do their own things.
Yeah, yeah,
Yeah.
for sure. And you know what? You have pretty amazing kids to show for it. What one is a lawyer and one is a doctor.
Yes, going to be anyway. At my
Uh,
school, in my building, living one floor below I did.
so incredible. So you did something right.
Yeah.
So let me ask you. So there's some other things I think that led to us sort of being successful. And we started. Well, what did we have when we first started? We had a tiny little practice with what, 3 exam rooms?
Yes. When we were with Roger and Aquabog,
Yeah. Yeah.
3 exam rooms and 2 receptionists, really,
Mhm.
and that's it, and a
And
biller,
now,
right? And
and what,
now I think we have more than about 50 staff
yeah,
and 11 providers, 12 maybe now.
11 exam rooms.
Yes.
Yeah.
Well, actually, if you count the second
Tw-
location, you can add 7
Oh,
more.
right. That's
Yeah.
right. We have 2 locations, of course. And now we
Mhm.
have that sort of third, the satellite
Yes,
where we're
that's
doing the
right.
breastfeeding visits. So we
Mhm.
really, I mean, it's constant. So that's one of the other things that I think is secret to our success. And maybe we could talk about that for a minute. And um, you and I whenever it would become routine and it was never stagnant. We kept, when are we getting to steady state, right? We used to say, when
Right. Yeah.
there was always a new project, a new initiative. um let's talk about a couple of those that we've taken on over the years.
Um, sure. Well, I mean, the practice started as Peconic Pediatric and Breastfeeding Medicine. So the first thing was your breastfeeding practice that we
Right.
brought to Eastern Long Island. Um, and we helped train some of our own staff to become CLCs, right? So
Mm-hmm.
that was definitely something that was uh, part of our base. I think that we expanded the practice to include mental health, right? So I did the Project Teach program very many years ago, and started to see children and adolescents who had mental health problems. That was not something that we were trained for in
Hmm.
residency,
Yeah.
but it was something that was incredibly needed, maybe not nearly as needed back then as it is now. We partnered with Family Service League to bring in-house counseling as a part of that sort of mental health program. And slowly but surely, every single person, every single clinician, I think, maybe with the exception of one or two right now, has gone through the Project Teach program.
Hmm.
We have a robust mental health program in our office. We see loads of kids and teens who have issues from ADHD to anxiety and depression. I think we help a lot of families with that because resources are so poor where we are. Um, you
Yeah.
brought on nutrition.
Yeah, we
Uh,
actually had my mother
your
come for
mother,
many years, right?
right, for many years, came and saw some of our patients and families, uh, and educated them. And we did group sessions and nutrition with a dietitian that we found. And we know, it's not nothing new, the epidemic of childhood obesity, and I've
Hmm.
got developed an interest in that, and now trying to start weight management with
Hmm.
kids. And unfortunately, it's both sides of that spectrum.
Yeah.
Um, and so that's really something I think that pediatricians are all going to have to be doing, just like we weren't trained to be, providers of mental health care in kids. We
Hmm.
have probably, you know, feels like primary for us out on the East End.
Yeah.
I think the management of childhood obesity is going to be in the hands of general pediatricians very soon,
Yeah.
and after that, the management of developmental disabilities and autism, because
Yep.
there's no services, access, where we are for that either.
Hmm.
And I don't even think that there's access in, even in Western Long Island.
Yeah.
There's so few developmental pediatricians. So I hope to improve my knowledge in that area. That'll be the next thing for me, at least.
Yeah.
But I,
Because, you're describing the landscape of pediatrics and how it's changing. And to be forward thinking and evolve and change your practice to meet the needs of the community, we keep trying to recapture the patients who are going to urgent care for their sick visits. And that's all well and good, but I don't think we're ever going to get those back because it's just more convenient to go to the corner store
absolutely.
to get your pink eye taken care of or so
Right.
I do think that we're more of a chronic care shop in the future.
I think that as pediatricians, those are the things that we should be focusing on. Over the years, I've asked a lot of my patients as I've sort of moved to really doing much more of this type of care, and not seeing as many sick visits. I've asked families, is it okay? Like, I'm not available as much for these things. And like, absolutely no. We want to see you when it's
Right.
checkup. We want to be able to see you when it's something that we're worried about.
Hmm.
Um, and I
Yeah.
think that's pediatrics now, and, in general, pediatricians are taking care of things that in the past we would have sent off to specialists.
Right.
Mm.
It's frustrating on the one hand, when we worry about our bottom line and the patient comes to see you and says, like somebody came to me recently and said, I've had 3 ear infections at urgent care, and now I want to see you to talk about what I should do about that. Right. So I they trust us with the
Right,
important decisions. I get
right.
it. But it's a half an hour drive to come see us, but the urgent care is 2 seconds away. And so that's our reality. We have
It
to kind of
is.
respond to that.
Right.
Yeah.
I don't have a problem with that. I think that if that's convenient for a family and it's not something that is really important where they should be seeing
Hmm.
us, it's a chronic illness or something with chronic care management. Um, you know,
Yeah.
if the patient goes to urgent care every now and then, it doesn't
Yeah.
cheat me.
But that speaks to our sort of, you and I have always had that philosophy that if you don't focus on the bottom line as your number one
Right.
priority, right? Of course, it's a business and we have to focus on that, but we've always really um, followed our gut and our intuition to make decisions that were best.
Yeah,
right?
I think so. I think that if you take good care of patients and families, and you will your bottom line will be okay, because your schedules will be full, because people will come to you because they know that your practices good medicine, because they know that you'll take the time with them when they have a problem that needs that time. I think that helps develop your reputation. And again, bottom line, if your schedules are full and you're seeing
Hmm.
patients and you're taking good care of them, it should be okay.
Yeah. Now you've also done a lot in addition to developing the staff and finding us employees and developing the staff. You've done a lot to develop the clinicians as well. And there's on the one hand our clinicians who work for us, giving them opportunities, always sending them information about conferences, and we have a couple of um, clinicians who have done extra training in asthma or
Mhm.
in feeding therapy, various things. But you've also taken on for Allied as a whole a bit of an educational program for all of the clinicians. So tell me a little bit about that. And
Yeah, so actually we started this in our practice. As we were looking to hire, uh, we found that what we were able to hire were many young new graduates.
Mhm.
And that's great. It's great to be able to, again, foster these young people's education, their career. They're coming out of either finishing up their nurse practitioner school or from PA school, but we found that they definitely needed some mentoring and some education. Interestingly, when I spoke to one of our more senior physician assistants, who is just fabulous, I asked her, "How long did it take you to really feel, comfortable?" And she said, "Probably 3 years, kind of like a residency." And that, like, sent off a light bulb to me. And we had decided that they definitely needed to learn more, just general knowledge about general pediatrics. They're really good, our nurse practitioners and our PAs coming right fresh out of school with interviewing skills and basic physical exam, but some basic knowledge, they needed. So I modeled a program after basically the program I did with medical students during their clerkships. And it's just a series of sessions that are based on uh, the concept program that I used, like I said, with medical students. And they have different topics, whether it be health supervision, newborn issues, issues related to the adolescent, renal, all different systems. And it's about 16 weeks. And we review things and help them to develop differential diagnoses. Often said that what I'll find with people who are new, and it's probably true of us when we are new, is that you kind of know what to do, but not sure why you're doing it.
Hmm.
So I thought it was important that they knew why they were doing it, because you have to understand why you're doing something to be able to think broadly about problems, and make sure that you don't miss things. So yeah, we did that in our practice with three fairly new nurse practitioners, and they loved it. And you had suggested that this be rolled out to our larger group. And I'm just about to finish up a session with eight um, new people, and I think it's gone fairly well. I've brought in others in our organization to talk about things where they have expertise. You've done a session, and others have, and I think it's been well received. I think they've learned.
Hmm. It the people who I've spoken to have gone through it really enjoy it. I think the biggest challenge to it is along the lines of what you just said about parenting and also preparing for charts. It's that um the home offices
Yeah,
who have to carve out time for their nurse practitioners and PAs to attend those sessions are struggling with their emotions around, carving out time and prioritizing their education over their seeing patients.
sure.
And, I think that it is very, as we say, what is it? Penny wise and pound foolish. We've really got to invest in them and prioritize that. It will pay off in
Right.
huge
Yes,
dividends in both their, becoming amazing clinicians and also in their loyalty to you because they feel like you value them.
I think that's exactly right. So, I hope that hours stay with us because they're wonderful. And the group that I'm teaching now is terrific, and we have some superstars in it. And I hope they stay with Allied. But I think, yes, I think that if you treat people well, you have a better likelihood of retaining them.
Hmm.
And, retention is really important. So,
Yeah, for sure. So one of the last things I think I want to touch on is your other area. You have so many amazing qualities. I just love working with you. Um, the value of connecting the practice to the community.
mhm. um, I guess I'm going to relate that just back to my childhood, right? And sort of realizing that uh, part of what I wanted was to have that clinic on the end of the block and to be able to support the community where I grew up and where I lived. So I enjoy um, reaching out. I want to serve as a role model maybe for these young kids who didn't grow up with as much as others, or in a place where they don't think that they can achieve success. And that's part of why that's maybe the selfish part of why I like doing it. I love going out there and being able to tell kids, look, you can, be anything you want to be. I say it in the office all the time. But also to just know who's in our community and know what it is that we need to offer. I don't think people understand what an issue transportation can be for some of our families. So, just getting to know your community, knowing what the needs are. If you're going to be a general pediatrician in a community, that's sort of what you need to do. I mean, I remember hearing stories of your father-in-law, of Dr. Lau, and of people like Dr. Mercier. These were single docs, country doctors who worked in the community that people called for anything and everything. And I think it's just part of being a general pediatrician. You're supposed to be part of the community.
Yeah. And you take it really into the community, partnering with some of the organizations that are providing extensive resources for our families, bringing them into the office, having our staff go to community events.
Yeah.
It really makes people feel part of something bigger.
Yeah, and I think again, just sort of from the staff perspective, a couple of years ago, we sent one of our staff members. She actually came to us without any training, and we trained her to be a receptionist and also to be a medical assistant. Sent her back to her home high school for career day. And boy, just to see the glow on her face when she returned, we have a great photo of her. And just a week ago or so, there was an event at Riverhead High School that three of our staff members went
Hmm.
to, two of whom were also alumni. And they just had a blast. They loved it,
Yeah.
So I think that it's not just good for our practice, not just good for us. It's good for our staff. It's a plus all around.
Yeah. And I'll say two of those employees who went to that event are in the process of training to become health coaches, which we have invested in them uh,
That's right.
to
And
do.
I think again, that's something that if you show that you're going to invest in your staff like this, and this is like a serious investment, again, this is going to help you retain them.
Hmm.
They understand that you actually care about them, their family, their livelihood. You want to help them improve themselves, all of that. Who's going to want to leave that for, a dollar more somewhere else?
Right. Right. So, okay, we are now at the stage of our career, Fatima, you and I, where we're sort of thinking, if you think about your career as an arc, we're sort of on the other end of that arc.
That's right.
Take a few moments to speak about how important succession planning is and what you and I are doing around that.
Well, I guess we're in the thick of that right now. So there's a reason we have the time to talk right now, and
Right.
that's because there are other people in our office seeing patients and managing the practice. Um, I'll take that even back to staff and retaining staff. You're retaining doctors, right? And knowing that they have a place where they can grow and grow their own interests and their um, ideas of what kind of leaders they want to be. It is important. And I think that, again, you have to be role models for them. It's embarrassing a little bit to say that, but you do have to sort of I always like to say that I'll always be the hardest worker in the room, right? Because I want people to see that I'm willing to work that hard. If you want something to do something for you, they have to know that you, at least at one point, were willing to do all of that. So succession planning is important to keep the practice running, but also just to give opportunities for growth for young pediatricians, for young doctors that are in your practice.
Yeah.
I don't know if that answers the question,
It
but
does. I know. I
yeah.
mean, I see so many doctors who just go through their career and then they decide to retire and they close up shop,
Yeah,
right? I think what we're doing is a nice alternative, which is developing, teaching the things that we've learned over the years to the younger, newer
yes,
doctors who will then, continue it on and we can be proud to see the practice hopefully live on for years while we're
absolutely, absolutely, and, the things that I hope that, as our practice grew and changed, we needed to do sort of less of the nitty-gritty stuff. I mean, there was a point in time that we were paying bills, right? Writing.
yes.
We're not doing that as we belong to a larger organization, and we have a lot more support in the areas where we really didn't have much training or education and background of finance and HR and IT and all of that. And hopefully that gives us the ability to focus on other things like building staff and building relationships
Right.
and being able to be out in the community. And that's kind of what I hope that the people that we're working with now see, that that isn't something that they can do
Right.
as well.
That's a part of you can't outsource the local culture of
Right.
the
Mhm.
practice.
Right. You can't, right?
Right.
Mhm.
All right, Fatima, this has been so much fun for me to chat with you. Do you have any parting words of advice or last things to say to our listeners?
I would just say to, be kind to your staff, to understand where they're coming from. Try to understand them as people. They're not just people that are clocking in. Get to know them, get to know who they are, help them grow. And I think you'll have a very healthy office if you can do that.
Yes.
Mm.
All right. Wait, actually, what about crossing the lines, right? Of maybe
Yes. So that can be difficult, but you have to maintain that sort of, I don't know if I want to call it distance, but an understanding that you are colleagues and you work together, but that does not mean you can't understand another person. Uh, it doesn't mean I'm going to be socializing uh, with people that I'm working with. I have some rules. I do not
Mhm.
social media. I am not friends with anybody who I work with at all. And I think that's really a hard and fast rule that everybody should stick by. And I don't think that wanting to know about a person or who they are or what their desires and dreams are is something that you can't do as a boss or
Yes,
as an employer.
agreed.
But
All
yes, there
right.
are some lines that you shouldn't cross.
Yeah, for sure. All right. Thank you again, Fatima, for joining me and for all of your wisdom. And I can't wait to see what's next in store for you.
Yeah, me too. All right, having me again.
All right. And I will send a great big thank you to all of our listeners for spending your precious time with us and hope to see you again on the next episode of Reinventing the White Coat. For this episode of Reinventing the White Coat. If you enjoyed this conversation, subscribe now so you don't miss an episode. If you're interested in coaching or in being a guest on the podcast, you can reach out to me online at sharecoaching.com. Thanks for listening, and don't be afraid to live your best life.